Ghana has become the first country to receive coronavirus vaccines through the World Health Organization's COVAX scheme, which aims to distribute free injections to low and middle-income countries. On Wednesday, 600,000 doses of the AstraZeneca drug arrived in the capital, Accra. Frontline workers will receive the doses first, followed by the elderly. But even with the WHO's help, there may not be enough to immunise the majority of Ghana's 31 million residents. And as Mobin Nasir reports, the rest of Africa is also facing an acute shortage of COVID-19 vaccines.
Months after the US and European countries began immunizing their populations, Ghana has received its first shipment of COVID-19 vaccines. It's the first country to benefit from a World Health Organization program that aims to ensure developing nations have access to the jabs. The drugs have arrived as the continent grapples with a new variant of the disease which originated in South Africa.
So far, 6 African countries and areas have confirmed cases of this variant, including Botswana, Ghana, Kenya, Mayotte, and Zambia. Beyond Africa, the variant has been confirmed in 24 countries globally, and there's concern it is circulating in other countries in Africa as yet undetected.
On Wednesday, 600,000 doses of the AstraZeneca vaccine were delivered to the small West African nation. The WHO hopes to provide enough jabs to Ghana and other African countries to inoculate up to 30% of their populations by the end of this year. But that's not enough to reach herd immunity. Experts say that figure needs to be closer to 60% of the population. While logistical hurdles like the availability of cold storage and distribution networks in poorer countries are part of the problem, African leaders say a bigger concern is wealthier nations purchasing more vaccines than they need.
Rich countries in the world are holding on to these vaccines, and we are saying release the excess vaccines that you have ordered and hoarded.
The WHO shares their concern and is appealing to the US, EU and other developed countries to step up.
So far, 210 million doses of vaccine have been administered globally, but half of those are in just 2 countries, and 80% are in just 10 countries. More than 200 countries are yet to administer a single dose.
There is some hope that the COVAX rollout can be expanded in coming months. Reversing his predecessor's policies, US President Joe Biden has committed $4 billion to the WHO's initiative. But many more contributions are needed for the vaccines to reach the most vulnerable. Mobin Nasir, TRT World.
For more on this, let's go to Tarik Jasarevic in Geneva. He's a spokesperson for the World Health Organization. Also with us is Doctor Andrea Feigl. She's the founder and CEO of the Health Finance Institute in Washington. A very warm welcome to you both. Tarik, could I begin with you? Ghana, as we heard, has received the first shipment of COVID-19 vaccines under the WHO's and Gavi's COVAX initiative. How significant a milestone is this?
This is a very important day, really, and this shows that the COVAX facility is working, that we are able to achieve our goal of providing safe and efficient vaccines in an equitable manner to health workers and priority populations around the world. So this is, in a way, an achievement, but it's also a beginning of a long and most ambitious operation of vaccinating populations around the world. We hope that we will be able to deliver 2 billion doses of COVID-19 vaccines to participants in COVAX facilities by the end of this year. So we are very much happy to see planes arriving in Accra, but we are looking forward to have other countries receive their doses as well.
Yes, and I want to come to the progress of the COVAX initiative in a moment. But Andrea, how important is it that people from low and middle income countries actually receive a vaccine?
Thank you for this question. It's absolutely crucial because we know that in global crises like these, when infectious diseases and pandemics spread, we're all in this together. So we are, as a world right now, in a race to basically vaccinate faster than mutations that potentially are more infectious and deadly can spread. So it is absolutely crucial for global trade, let alone for the persons potentially with weakened immune systems and healthcare workers faced with on the front lines to receive this vaccine. It's also important for the economies, and it's also important for solidarity, because as we know, vaccine nationalism has made front page news these days. And so it's a very welcome development to see the first shipment to arrive in Ghana today.
Tarik, describe to us the progress that's being made under the COVAX initiative. Can you tell us, is it on schedule, and which countries are next in line to receive these free vaccines?
Well, the COVAX has been put in place earlier in 2020, in the first part of 2020, because we knew from the very beginning that vaccines would eventually come, and that it's essential that these vaccines are accessible in equitable manner to everyone. We have to go several steps before we are able to ship these vaccines. We need to list vaccines after reviewing their files on the clinical trials under emergency use listing. And this is what we have done at WHO for Pfizer and AstraZeneca vaccines, as well as for Moderna. And we hope that more vaccines will come with the time. In the coming days, we are going to publish a new allocation document where we will have more or less a list of countries that are part of COVAX and number of doses that they can expect in coming weeks and months. It's important also to know that this distribution will be carried out depending on the readiness of countries to use these vaccines. We still know that Pfizer vaccines requires a special storage. This may change in the future, as we have been receiving good news about that. But we wanted to make sure that countries are ready to use the vaccines as soon as they arrive. And also, it depends on a production rhythm that is happening on a production sites that have been authorized. So, for example, today's shipment is coming from Serum Institute of India that has been authorized by WHO to provide AstraZeneca vaccines. We hope that we will have more manufacturers, we'll have more vaccines, we'll have more production sites, so we can roll out these vaccines to countries around the world.
Andrea, US President Joe Biden has committed at least $2 billion to the COVAX initiative in 2020 and 2021, and that's after the previous Trump administration refused to make any contribution to the initiative. Tell us, how important is it that richer countries do in fact help out poorer countries receive the vaccine and really get this pandemic under control?
I think the new developments coming from the Biden administration for us global health advocates are really a step in the right direction and are very welcome from a health and a humanitarian perspective. And as mentioned, the vaccine nationalism, so rich countries basically trying to basically stand first in line and really leave poorer countries out in the dry is not just a humanitarian and a solidarity crisis potentially, but it also doesn't benefit from a trade perspective, from a supply chain perspective for trading and goods, the richer countries either. So I think it has really two benefits that that Biden is stepping back into the global health arena, representing the US and also contributing at a global scale again. It helps on a humanitarian level, and it helps on an economic level. And just to add a few numbers here, there's some modeling that has shown the faster we reach herd immunity or global immunization at a high level to beat this virus, that could basically lead to 2 or 3% GDP growth increase in 2022. So it's really in everyone's interest to support vaccination rollout financially and at the humanitarian level.
Okay, we will have to leave it there. Tarik Jasarevic from the World Health Organization and Dr. Andrea Feigl in Washington. Thank you again to you both for joining us on Money Talks.